Hi there, doctor. My question is, I heard you talking earlier about hormone replacement therapy for women.
You betcha.
And I've always heard that there was an increased risk of cancer, and I'd like for you to speak to that concern.
I'll be happy to. Okay, it works something like this. Okay, as a female, okay, your hormone levels were at their peak between the ages of 20 and 30, which is just about the lowest risk that a woman has for breast cancer or any ovarian or uterine cancers. The incidence and prevalence of these cancers go up with age as the hormone levels decrease. So that's the first bit of data that you need to understand. The second one, which is even more interesting, okay, is that, it's an estrogen-positive tumor. Well, most genes actually are off switches. A gene is a switch. It's an on switch, off switch. Most of them are off switches. So if somebody goes, it's an estrogen receptor positive, well, the question I would have, does it stimulate growth or does it inhibit growth? Because most of those receptors are inhibitory. There was a professor at Duke when I was there. That guy's name was Bill Kreisman, and he spent his life's work, okay, looking at cancer, all sorts, all kinds, all causes, having to do with hormone and hormone replacement. And he found that there was no increase in cancer risk with bioidentical hormone replacement. The only hormone that did have any increased risk whatsoever is a progestin. So when you look at the Women's Health Initiative study way back in the 70s, where it showed there was a minor risk, it had to do with something called Prem-Pro, which was a progestin. The Premarin itself, there was no risk. That's not my favorite hormone by any stretch. However, there is no increase in risk. So I do it quite routinely. But that being said, you check levels. Okay, every 90 days, 120 days, blood levels are checked. And if you're putting these things in a safe range, a nice range, there's no increased risk. And in fact, it probably decreases your risk of cancer. Because as you increase people's cellular health, cancer risk decreases. One other thing I do to decrease cancer risk in patients is to use metformin. And so, Jill, I would encourage you to look up metformin and cancer risk, metformin and cancer prevention, metformin and cancer longevity. And I think you're going to be shocked at the fact that metformin decreases your risk of cancer by 50%. So when you're worrying about, increasing it by 1 or 2% or decreasing it 1 or 2% and arguing that out, metformin drops it by 50%, vitamin D drops it by 50%. So there are lots of things you can do to decrease your cancer risk, but HRT probably decreases it as well.